Welcome to Focus TV for our community today. Hello, everyone. I'm Gwendolyn Borg, the president of Focus for our community unity and support. You can find us at forourcommunitytoday.org. And I just want to actually talk about today a new series that we're starting. It's called Addiction Prevention 101. It's a series that will starting September. It will go all the way through June. And today, our very first session is called the Strategic Prevention Framework. It's a comprehensive approach to understanding and addressing the substance misuse and related behavioral health issues facing our community. So as you can see, every second Tuesday of the month during our General Coalition monthly meetings, the Western New York Prevention Resource Center will be at our facility, at our office, conducting a training. And these are the topics that we've agreed upon. So all these little sections right here is what they will provide an education on. And what I do is I take that general education and I'm going to document how this applies directly to us, what we've done as it relates to that particular portion of what we do as a federally funded addiction prevention coalition. So as you can imagine today, we're going to talk about the strategic prevention framework. It's could be complex type of scenario. It's a model basically that the federal government through the White House Office of Drug Control Policy has really approved with the help of SAMHSA, which, if you know anything about, the federal and state houses of who provides the data, the research, the ways, the programming, the planning to be able to help any type of addiction or substance use related issues. SAMHSA is an acronym, and that's really for the type of model that we use. That's our federal house, and that's the model that we follow. So I'm going to share my screen. I'm going to show you exactly what it looks like. So here's the very beginning of the document. You'll see SAMHSA, Substance Abuse and Mental Health Services Administration. That's the federal office for addressing, collaborating, creating the data and research that we need to be able to be effective in the substance use and mental health field. So this strategic prevention framework, it was developed by our federal office. It's enforced by our federal office. And that is what we're going to focus on today. This little piece right here, the strategic prevention framework, this right here is the actual model. And we're going to do a quick little overview on just what these little components are, how it applies to us, and show you what exactly we've done as it pertains to this particular model. And hopefully you'll leave today with a little more understanding on what we do as a coalition and how we apply that information to helping our community. And as you can imagine, this looks pretty basic. It looks basic. It's not. There's a lot that goes into that. So, we're going to start kind of walking our way through this framework, over the next, so 6 months or so until the end of June. And we'll probably restart up again with where we're at in this process coming up again in September of the following year. So the strategic prevention framework, and how did I categorize that? I said it's a comprehensive approach to understanding and addressing substance misuse and related behavioral health problems facing our community. So we're not looking at the individual in this particular approach. We're looking at the community as a whole. We're trying to understand what the problem is, and we're trying to address those problems, not only the substance in itself, but the related behavioral health problems that coincide with those particular substances that we're trying to address. So when you see, these things like this, assessment, capacity, planning, implementation, evaluation, These are environmental strategies. These affect the community as a whole. This is population level change, these particular petals to the flowers. A lot of people would, create that type of metaphor that this looks like a flower. And in the very center, sustainability and cultural competence, these are the guiding principles that affect every single portion or petal of this strategic prevention framework. As you can see, very first thing up, assessment. What does assessment mean, right? Assessment is to identify local prevention needs based on the data. What is the problem? How can you be effective if you don't even know what the problem is? So the very first thing we did when I was voted in and sworn in as president of January of 2018 is I started working with the Western New York Prevention Resource Center. That's the state, we'll call it state support office that works with our state substance use and mental health office. They said, Gwen, there's a way to do this, and we first have to follow this process. They showed me this process, and like first we need to assess the problem. What is the problem? So the very, very first thing that we did is we surveyed the students in 8th, 10th, and 12th grade in the Lancaster and Depew schools with a federal approved survey called the Prevention Needs Assessment. It has core measures for us to be able to know what exactly was happening. And through that, we were able to figure out like a baseline. What was our baseline? So this survey was designed to assess students' involvement in a specific set of problem behaviors, their exposure to a set of scientifically validated risk and protective factors. The risk and protective factors have been shown to influence the likelihood of academic success, school dropout, substance abuse, violence, and delinquency among the youth. So this is scientifically validated. These types of exposures, these risk and protective factors, it was all in this survey that thankfully Lancaster and Depew schools willingly went full bore in. That the last time they did this survey was in 2014, I believe. And this is the result. So if you go to forourcommunitytoday.org and research under prevention science tab, this is where you're going to find all the results of this survey. So you're going to see that it is extremely involved. You see all the numbers to all the students. You see all the different types of questions that were asked, how it affected their behaviors, the perceptions of it, how it relates to this particular framework, and so on. So that was our baseline start. That's where we started when it pertained to the baseline of our research, right? So we started there. Just want to make sure my window's showing. The next thing we had to do was capacity. And I'm doing the quick snapshots of these guys just so you can see, our process starting from the very beginning. So you figure, okay, January of 2018, we go full bore into, first we had to be a legitimate 501c3. We had to do funding. We had to be a 501c3 incorporated. We had partners come alongside the Teachers Association and local organizations that funded us to have that entity, solidified. By the fall, we had agreement between two schools to survey those 8th, 10th, and 12th grade students. So there was our assessment, right? By January, spring of that year, that data was then evaluated, put into, that report that I just showed you from someone who actually is approved as a federal evaluator, someone who takes that data and evaluates it and is approved by the organizations that, the ONDCP, CADCA, SAMHSA, all these acronyms that are part of our world, to be able to reveal that information and provide that information to the community. So that was the first step. And in the process of that, we had to build capacity. That's the next part, right? You can have your baseline data. You can see, okay, what were our major issues? Okay, we saw out of all the substances, marijuana and alcohol. Those were the most prevalent two substances used within a 30-day window between these students locally. So those were the two substances that we were going to address. but we can't do that without people. So the next step was capacity. We had to build these local resources and readiness to address the needs. Like, what do you have to work with? So as you can imagine, we did a lot. I brought in a lot of people from the addiction recovery world. I had already had experience and success creating an addiction recovery not-for-profit called I Know. I'm a New York State Board certified addiction recovery coach and trainer. I'm a certified addiction recovery coach. That's a state credential to teach people in the addiction world about addiction. So I brought those resources in, and it helped give us a nice little kickstart into the organization. So now fast forward, we're January of 2019 at that point. We're building capacity. We need to bring people to the table. What resources do we have? People, what type of funding, finances do we have? What type of resources do we have available to us that could be in-kind donation, office space, flyers, being able to print things. We had to continuously pile that in. This is a continuous effort, right? And the next part of that was, okay, now it's planning time. And what I'm going to do is, although we eased our way into a lot of the planning components that are federally approved through this model. 2019, we did a lot of events. We wanted to get the word out there on who we were. We branded ourselves, website, things like that. And by December of 2019, we had spent a good 6 months taking all the data, building capacity, creating committees, and applying for the Drug-Free Communities, or DFC, community grant, which was housed through SAMHSA office at the time. It's now monitored by the CDC, but it was through the White House Office of Drug Control Policy. So we were like, all right, if we're going to have a chance at funding, the only way that we're going to get funded is if we can prove that we can have some sort of impact and we can measure our results. So we created a 100-page grant and submitted it in July of 2019. December of 2019, we found out we were one of the grantees. It's a 5-year grant, and they wanted a 5-year plan. What is your plan if you're going to get this money to be able to reduce those numbers and create community collaboration, which is what they want? So planning, how do we address those prevention needs, and how do we do it well? So their example is, what should you do and how should you do it? So what I want to do is I want to show you some of the documents that we put together as part of the actual grant. This is their format. So what is the Coalition's 12-month action plan for addressing the youth substance use? So this is my 2021 action plan. This is a piece of what I had to do, obviously, for the grant. But there's 2 goals that you cannot change. So this is part of the planning of this particular framework. Goal 1, increase community collaboration. You cannot be sustainable. You can't do what you need to do long-term if you don't have the community behind you, if you don't have them, at your side and helping you. And goal number 2 is to reduce youth substance use. That is the goal, So what we did in this grant in 2019, 2020, we had this action plan submitted. We had the goal. We had, which could not change. We had an objective. What was our objective? To increase the number of parents engaged in the coalition by 4 people within that year. So this is my action plan for this year. And you would think it's not that hard, but you know what? It's hard. It's been hard getting parents and youth engaged, especially after COVID. So what we did is when we plan, this is the process that we have to do on an annual basis, and we have to submit this to the federal government. They have to approve our plan, and there is a process to it. So if the goal is to increase community collaboration, you have an objective. Okay, well, what's the objective? To be able to do that, okay, we want to have more parents involved. So what are the strategies? First strategy is to provide information to the parents about the coalition. And how do we do that for this example? Well, there's the activity. What are we going to do? who's responsible. We work with 12 sectors of the community, ranging from youth to education to law enforcement and business, you name it. There's 12 sectors that represent the full community. We create who is in charge of those sectors, like who can help us with that, and then a due date, by when. So each of these have like little mini steps. So here's another one. Another strategy to bring more people to the table is to provide that survey to the parents at a town hall, right? Here's the activity by December 30th of 2021. So we're going to do that again. And we do it every single year. But the backup to make this happen is, okay, well, if we're going to do a town hall, we have to promote the event. We have to create the event. We have to get that information out with the help of the sectors, like all the different people that can help us. And we have to do that by the 30th so that we can actually have a successful event by that date. So this is just a quick little breakdown of those types of things. You know, with the other one, the main one, to be able to reduce youth substance use, we have those 30-day averages measured by that PNA survey that we did. And we're just trying to reduce it. You know, just give us a couple percent, you know. We're only looking, we want to be reasonable. And we especially want to be reasonable right now in the after effects of a pandemic, which are still affecting our kids, and rates of their use have not been, you know, it hasn't been good. So we know nationally, all right, we'll know more when we survey our students again this fall and we measure that against our 2018, 2019 data. But little small thing, right? Little goal. And we want to measure our goals. So in order to do that, again, more objective, that's our objective, more strategies, you know, provide support, review and monitor alcohol sales, you know, provide information on marijuana. We knew that was going to happen. So you take all these things and all the dates, and what I do is I break it down into something a little bit more bite-sized. Here's the action plan. Here's our goal number one. Here's our goal number two. And here's the strategies and the dates by which we have to complete those. So, you know, I'll take all the objectives, the strategies behind it, and then I'll kind of break it down into, all right, we got drug-free events, we have outreach events, we have educational type policy, change, review, adherence, law type things. I put them all into a document and I send that out every single month before our meetings. So people can see, okay, this is where we're at on our timeline. This is what, you know, we put into our grant that the federal government wants to see as complete in order to create that community change. So you can see there's a lot of planning that goes into this. We have planned a year in advance. We just wrote our year 3 action plan and year 3 budget that we will automatically initiate come January 1st for 2022. So going back to, you know, our strategic prevention framework, that's planning, right? Implementation, you guys kind of saw a little piece of that, right? So we have to deliver evidence-based programs and practices as intended. How can you put your plan into action? That's this part of the particular strategic prevention framework. And honestly, the implementation part, that's those little tidbits that I showed you. So, you know, here's my action plan. You know, if we know that, you know, for instance, you know, what do we want to do? Fall Fest, plan and host an alcohol-free scavenger hunt activity walk event. That's Fall Fest, right? So we knew that that had to be done by August 30th, 2021. We needed these particular people involved, and we needed help by August 31st for people to also sponsor a live alcohol-free music event in the community. We did that. That was called Glow Fest. That took months to prepare. So you take these activities and you basically, you know, create like a little, what I do is, you know, we create a little cheat sheet. Where's my action plan? And we try to implement it. All right, guys, this is where we're at. What do we need to do to make this happen? It starts with committees. We create committees for these particular things. The music fests are probably it'll have to be a virtual health and wellness fair. The town hall event, youth recruit escape room, community outreach event, the reviewing the alcohol laws and stuff. All these things, we create committees, and the committee meets outside of the actual scope of our monthly meetings, and they do Zoom calls. As of recently, they get together and they talk about these types of things. We bring in experts, whether it's from law enforcement or youth serving type of organizations like Kids Escaping Drugs or Erie County Prevention Council, and we bring the experts to the table to say, all right, how do we implement this, and what is our timetable, like a SMART goal. SMART goals can be short, medium, or long-term range. So we need to be specific, we need to be measurable, it has to be attainable, it has to be, realistic and time-based. So we want to know by this date, we need to do that. So when we wanted to review alcohol sales laws, like the drive-through, margaritas that were happening last year, we wanted to review those laws by 2/20 this year. We wanted to monitor their adherence, which we just completed. We want to recognize the businesses that did that. So that is like the timeline, right? It took us 6 months to be able to complete one particular project, but we set dates, timelines, and we made it happen. So I would say that's like the implementation component of it. The next part is like, once something is done, you have to evaluate it. So you examine the process and outcomes of the programs and practices. Did your plan succeed? We know that, when we decided to review those alcohol type of laws, those drive-through alcohol laws, at the time, New York State just put the kibosh on extending this emergency order for restaurants to be able to have to-go alcohol. And that was our plan, was to see like, okay, how is that working? And there's a lot of changeover in employees right now. A lot of people are short-staffed, especially restaurants. So how is that working out? So we looked at the laws, and then we monitored the adherence. So at the time when that was put to rest, so what we did is we monitored like DoorDash and Grubhub, these delivery driver apps, and will they leave a 6-pack of beer at the door even though they're not supposed to. And then from that point, we assessed everybody who participated in this type of campaign, who passed, who didn't, what kind of steps do we have to be able to fix that. And believe it or not, we had someone out of what do we have, 5 people and over a dozen type of attempts to have alcohol delivered to a home using these delivery apps. One of those people failed. They didn't follow the process, the protocol of taking a picture of the ID. So it's like, all right, we looked at the program. Was it a success? Was it not? So we evaluate what our goal was, and then we evaluate whether or not we can measure, did it work, did it not, do we have valuable information out of that. And then the very last thing is the whole thing that happens continuously throughout this process is cultural competence and sustainability. So these are, they call them 2 cross-cutting principles that should be integrated into all these steps. So while we're collecting the data, while we're building the teams of people to help address these things, and we're planning out how, what type of strategies have been used that we can use to be able to implement and deliver these evidence-based programs and evaluate them, what should we be considering all the time? And I want to bring up too, I should probably, I don't know if I put it under my research tab or not. It is, so here's our, oh yeah, look at that. So here's the strategic prevention framework. So all these things that we follow are right under the prevention science tab of the website. Here's this and what we're talking about today. But these environmental strategies, so they work together with our state office, with our federal office. Were developed through CADCA, Community Anti-Drug Coalitions of America. John Brusso, my program director, and I, as the president, we completed our National Coalition Academy. We graduated this past February with the Academy, with the CADCA Academy, to be able to do these types of strategies effectively and ultimately be credentialed as certified prevention specialist, which is a accreditation for our prevention field. But these are the environmental strategies that we would think about when we're trying to plan those things out. So it's a 36-page document, and you can see though, it talks about, laying the foundation for community change. We look at the public health model, what are environmental strategies. These are where the strategies come in. So you guys click on that little document right here. You click on that, this picture, it brings up this. And this is where you're going to see all the information. All right. What are the environmental strategies? It's grounded in the field of public health. So these are the things that we do, right? We take all these strategies looking at environmental change. We're looking to change the community. That's what we implemented when it comes to this planning process. And it says that in order to be effective, we always have to imply that we understand the community, our culture, the ability of an individual or organization to understand and interact effectively with people who have different values, lifestyles, traditions, based on their distinctive heritage and social relationships. Depew and Lancaster, they're two communities right next to each other, but they're what is called communities within a community in both of those towns. You have very high level income, high income earning houses, dual income houses, making 6 digits. And then you have very low income that are on public support and public services. So who are those people? It could be socioeconomic, it could be race, it could be, religious, values, lifestyle, stuff like that. We need to know what the very heart of Main Street Depew needs versus, the cul-de-sacs off of William Road in Lancaster. We need to know the languages that each of these demographics talk, how they speak, how they learn, and apply those types of things as we implement these programs, as we implement these processes. And the other thing that we're always keeping in mind is sustainability. The process of building an adaptive and effective system that achieves and maintains desired long-term results. We cannot do this without building this long-term type of system, because these long-term results, they're long-term. They know, the government knows that this system, okay, and this concludes really our flower right here, the strategic prevention framework. But we know that this system, it's effective. We know, the government knows that it works. Otherwise, they wouldn't invest money on an annual basis for a little community coalition like ours for 5 years. They wouldn't do it. If they knew that this could happen like that, then they would, they'd give us money and within a year it'd be up and we're on our own, guys. But that's not the case. This is a 5-year grant. This is going to take at least 5 years to potentially have an effect. It's a population change that we're looking for. When you change the environment, you change the perception of the people in that environment. If you change perceptions, you can actually change the behavior. You change the behavior, you change the individual. So those are the things that we look at. This is the top level view of some of what we've done. I hope you appreciate it. Hope you learned something. And if you want more, then come back on a monthly basis to our monthly meetings where, you'll hear directly from our state partners through the Western New York Prevention Resource Center, who can give you the overview of what we're looking to do. So thank you for spending time with us today. Please go to our website and learn more about our process and come to our meetings the second Tuesday of every month and learn. Come to learn to have an effect on a community level. That's what we're trying to do. That's what we're achieving at this time, and we need your help to make it happen. Gwendolyn Bork, President of Focus for Community Today. You can go to www.forourcommunitytoday.org for more information. Thank you, and we'll see you next time, guys.